in our time together in the last few months and working together, we've made something truly great, and we're so excited that you're here to join in with that with us. And so a few months ago, we started off having a press conference to be able to bring you all together to really make sure the community knew what was going on, because there are some things that aren't right that are going on with the closure of services. And then we rallied together in terms of the Minnesota Department of Health hearing that happened a few short weeks ago. And that hearing essentially showed us a lot of very important things. And that is that the rules are rigged against the community. The MDH hearing was not as transparent that it should have been, which is why tonight it is important that you are here with us to be able to share with your concerns about hospital closures in your community, but also get questions answered if all of us as a coalition can do our best to answer them for you. And so, again, thank you so much. Our vision is for all of us to be able to come together to fight back against large corporate healthcare that's making these decisions despite everyone's concerns. And so appreciate all of you being here. And so in terms of kind of how tonight's going to look, we have a Q&A panel, and we'll have open panel question and answer session for all of you. And we also have a few special speakers with us tonight. We have Mayor of Spring Lake Park, Bob Nelson. We've got Representative Aaron Cagle, Senator Jim Abler, and Attorney General Pete Ellison. And so, this is truly a community event. And so before we get into a few of our special guests, I'd like to have our panel introduce themselves. And the first folks that you'll find that aren't here this evening are some of our Allina corporate bigwigs. We invited them last Friday to be here, and they have politely declined. And so it says a lot that those that are making the decisions can't even show up to be able to actually see what it's like and hear from the community in terms of, hearing from the actual people that are going to be impacted by these decisions. And so with that being said, I'll hand it over to Jenny.
I'm Jenny Block. I work in ICU at Unity.
My name is Larry Schindler. I work in surgical services in the OR.
Hold on.
My name is Alia Sharif, and I am a physician taking care of ICU patients at Unity.
I'm Kelsey Burks from Ankeny. I'm a pediatric hospitalist at Mercy Hospital.
I'm Zach Heidebrink. I live in the North Metro, and I'm a community member.
Thank you to our panelists. And so before we get into some questions, I'm going to open it up first to our Mayor of Spring Lake Park, Bob Nelson, to say a few words.
Keep it sweet.
Thank you all for coming. Unity Hospital served Spring Lake Park, Plain, Mountview, Fridley, all these areas for years. I've lived here for 65 years before Unity was even built. I remember cows on that ground. I had kids born there. I've had same fingers sewed back on there. Being a machinist, that happens, It's a great need for a community. We need those things. On Easter, I had a heart attack. I was there. And that was, and I'm glad you were there. So we got to keep up this fight. We got to keep it going and help these doctors and nurses take care of the residents that they were trained to take care of. So let's get everybody together and rally. I thank you.
Next up, we have Representative Aaron Cagle.
Thank you, everyone, for being here. I really appreciate it. I like seeing my mayor and city council members. When I was first elected 8 years ago, one of the people that was also on the ballot was the hospital board. And shortly after I got elected, the hospital board was dissolved, and Allina came in and bought that hospital for $1. Unity Hospital for $1. This is a place that has been in our community for nearly, 1955 it opened, and it's been a part of our community. People have had babies there. I spent a night in the ER with my brother trying to get him into a detox center. And just a few weeks ago, I was there with my grandma trying to get her back home to Silver Bay so that she could spend her last days there. And so this is a critical part of our community. And ever since Allina has come in, they've cut those services, little by little. And so this community, we can't go there and get the services we need anymore. And that's a problem. And so I'm here to help you guys in whatever you need. Like I said, I'm the state legislator for this area. I represent Unity. And I'm here to do whatever you guys need. So thank you all for showing up. Thank you so much.
And now I believe we have Senator Jim Abler.
Well, thanks for being here. You're my heroes. I'm just so you all can get up here and tell us why this is just a really bad idea to do all this. So I'm Jim Abler from Anoka. I'm Republican, Aaron's Democrat. We don't care. It's about the patients. It's about the quality of service to the community. It's about what's really important. How many of you in the audience here are doctors connected with the place? Thank you for being here. How many of you are nurses connected with the place? And how many of you are just plain regular human beings that want to stay connected to this place? All right. Anyway, so it's really good you're here. This is going much more difficultly than I thought. We had a hearing in the Senate. Did you want to? We tried to offer an amendment to have the Department of Health do a review and then approve it. We're on another version. During that hearing, Senator Chair Wickland said she would help. Senator Mann said she would help. Senator Kupek said they'd help me find a way to protect the needs of our community. And so we're making some progress, but this is not easy. There's a lot of politics in this, if you didn't know, not just election for Republicans and Democrats. There's big hospitals, big corporations, and all that. But at the end, the little people are the ones who matter, right? The people who need a pediatric overnight visit, like now, the people might need to have room to get an operation done, not like in 2 weeks from now, and the people might need an ICU to go in when they leave the OR. I don't know, it just seems reasonable to me. So I'm here to win, and so is Keith Ellison, my colleague and friend, and Aaron, and all the rest of us here. And so you're going to be given advice, but I'm going to give you a little advice just on the way. So it's interesting who likes you, who doesn't like you, but I'm going to urge all the doctors here to get a hold of the doctors in the Senate, Dr. Klein, Dr. Morrison, Dr. Mann, and say, would you please make sure we can give good care to the people? And to the nurses, keep doing what you're doing. Talk to everybody and spread the word, especially to the Democrats, because they're in charge right now, but talk to the Republicans too. You might be surprised that there's a lot of agreement on quality of care in the backyard across the state. And this is not just happening in our area, it's going to happen everywhere because some decision made by somebody else how they're going to close Boston, how they get rid of Albert Lee's OB thing and all that. And so what I'm working on now is a proposal to have Allina would submit to the Department of Health why this is going to work at all. And then when the Department of Health approves it, then they can go do what they're going to do. At least there's some adult in the room as we make these decisions across the state. Healthcare is changing, absolutely, but it shouldn't change to the detriment of the patients, and the staff have to be protected in that process as well. So they're going to talk to you about postcards and phone calls. Light up the phones. Light up the mail. Go down and drop it off in person. Talk to your own legislator, your own state representative, your own senator. You also have one that represents wherever you work, too. And so we can win this. We're not winning right now, but we're going to win. So God bless you all. Thanks for letting me be part of your team. You're so amazing. Thank you.
And up next, we have Attorney General Keith Ellison.
Thank you all for taking this evening out to come together with neighbors to talk about what may be the most important thing in any of our lives, which is our health and the health of our family, our access to good quality medical care. I'm your Attorney General, and it's my job to enforce the consumer laws in our state, also to enforce the laws regarding nonprofit organizations, which just about every hospital in the state of Minnesota is, and also antitrust laws. I came here today not alone, but with friends like my colleagues Jim and Aaron who are here. Really good to see the mayor here and offer his words, but also my colleagues at the Attorney General's office who are here in the room today. Actually, we're here, about 4 of us are here. So we're here to listen to you, to listen to the panel. We want to thank the doctors and the nurses and the healthcare professionals who truly care about the people in this community. It's funny because when the doctors have to stand up to the business execs on behalf of the patients, that shows you that they really are healers. And they want to heal not just the body, but the community's health as well. So thank you all. All these folks wearing the DC shirts and the MNA shirts, thank you, all of y'all, so much. We're going to be listening carefully. We're going to enforce the law as it exists to make sure that we are standing up for the best public interests of the people of this state. And we wouldn't be here unless we really cared, but we will be listening carefully to you. And I just want you to know that you can reach our office directly at 651-296-3353. 651-296-3353. We're looking forward to serving you, and we're looking forward to making sure that the people of Spring Lake Park in every community have the highest quality and access to healthcare services available. And that means justice here and now. Thank you all very much.
All right, thank you to our speakers tonight, and let's get down to answering and asking some questions. And so one of the things coming into this evening is we want to make sure that this is a space where all of you can use your voices as well. And so we wanted to start off with a couple of questions. And so our first question to our panel is one of the most important questions. And how will these closures impact patient care?
I can speak to the pediatric impacts, as I'm a pediatric hospitalist at Mercy. Essentially, with these closures, there will not be. Oh, you can't hear me. Okay. With these closures, there will not be any access to inpatient pediatric care at Mercy Hospital. That affects a large area of the North Metro and a lot of communities farther north. They can come to Mercy into our emergency department, but we are the only inpatient pediatric we're the only hospital that takes care of kids in the hospital, in the inpatient setting in the entire North Metro area. So it essentially leave a care desert for children who need to be admitted. The next closest hospital, I guess, would be Children's in Minneapolis or Masonic downtown. That's not a great option for a number of reasons, and maybe I'm answering more than one question here, but they're often full, especially during peak respiratory season, even late spring when we're seeing respiratory season die down. They're boarding children in their ER, meaning they don't have enough beds for the children that are coming to their hospital as it is. And we are we are kind of a pop-off valve, I guess, for children in the entire metro area and even in the state. And so with the closure, I guess my biggest concern, as well as those in my group, is that how are we going to take care of all the children, not even in the North Metro, but just in the metro area, when we have waves of respiratory illnesses and things like that. We already have a struggle being able to take care for them, and I think this is just going to make it a lot worse.
When I started at Unity in 1998, we were running 10 ORs, about doing 42 to 50 cases a day of all varieties, general surgery, orthopedics, pediatrics, ENT, plastics. I forgot a few, but we worked our butts to serve the people like you in our community. As time progressed, Allina, particularly in 2017 when they merged the licensure of Mercy and Unity Hospital, that's when they started pulling services away from Unity and then bringing it over to Mercy. It started with children. Then it went to women, then it went to the OB, and then it just kept going on. Vascular left, and then all these services went over to Mercy over a gradual course of time. So when they say this was a decision that was made this year, it was a progressive thing that they've been doing for years and years and years. How will it cause? Right now, I have my friends back there, some OR nurses, some SARS nurses, some great people that work in the operating room at Unity Hospital. We have put total knees, hips, appies, colons, gallbladders, some heart stuff. We have done so much for the community of that Unity represents that it's going to be hard to see that hole in this area where you have to drive multiple miles to get care. Thank you.
All right. So next question that we have is, will these closures make it harder for first responders to get to patients in need of emergency and critical care?
I don't remember the numbers offhand, but in one of our press conferences, I believe somebody did present the numbers about what kind of ambulance delays are being experienced these days. I'm not sure if Allina has plans to increase EMS or ambulance services, because currently we do have significant delays in first responders, let alone ambulances coming to Unity to pick up a patient who's unstable. A hospital the size of Unity should have an ICU, simply because when you are taking care of over 100 patients, mostly elderly and the frail, things can go bad pretty quickly. And when things go bad, that's when you need the intensive care unit. So if you don't have an intensive care unit and you are anticipating that somehow the patient is going to be transported 15-20 minutes away, that's not the best way to take care of the patient. There are situations in which we do that. There are situations in which critical access hospitals on the periphery of big cities transport their patients by helicopter or by ambulance. And we all know that that's not ideal. It's happening all over the nation because hospitals just can't staff, or they're unable to keep their doors open. In this case, though, this is a metro hospital. It's not a hospital on the periphery or a small rural area. This is a very big hospital compared to that. I mean, over 100 patients. I believe we have the capacity for up to 170, and a lot of times, the medical patients make up a large percentage of that. So ultimately, I think what the closure of ICU means for the patients at Unity is that in case there is a deterioration, and we have around 2 patients to 3 patients almost every day who we transfer to the intensive care unit for instability. So are they all going to be stabilized somehow and transferred, 15, 20 minutes away? Again, that's not ideal. Bad things happen, and these are not stable patients. So I'm not sure what Allina's plan is. What we have been told, though, is that they are going to have some kind of a step-down unit. Step-down units are very different from intensive care units. They are staffed differently. The nurses who staff them, their skill set is different. The ratios are different. So they are good to have if you have nothing else, but it's not ideal care. An intensive care unit in a hospital this size is a basic requirement. And he was referring to OR closures and knees and hips. From my standpoint, one of the biggest disadvantages, or one of the most serious effect of this closure would be that patients need emergent or urgent procedures sometimes. And I believe I was told that there are at least 2 to 3 patients daily who are being added to the OR schedule, who are coming in either through the emergency department or they're coming from the floor, who need a procedure semi-urgently. I've been in a situation where I've had to send patients to Mercy for major procedures. Those are typically stable patients. We are anticipating that we will be transporting them. There have been other times that I've had to call a specialist to come in immediately and help me stabilize a patient by doing a procedure. If we don't have an intensive care unit and we are unable to do these important life-saving procedures, I'm not sure how we're going to make that hospital work. So I believe that these closures, hand in hand, will definitely have a detrimental effect on patient care.
Thank you. The next question we have is, will these closures lead to longer emergency response times?
I think this question, obviously, Dr. Sharif had mentioned transportation issues and the response time, just getting patients from Unity to Mercy in time for an emergent procedure or whatever they may need there. But it also will, it will lead to longer times in the hospital when you have that patient is crashing and you have a critical resource nurse. There's only one in the hospital. On night shift, there's only one doctor in the hospital to cover all of those patients. So that critical resource nurse is vital to all of us nurses to make sure that we can stabilize that patient and get them wherever they may need to go, whether it's to the ICU at Unity or if they need something more emergent at Mercy. With the acuity that could potentially happen now with matrices changing and nurses needing to take care of sicker patients, requiring more care, and there's expected to take more in a step-down unit where the ratios are different. You don't have the resources. It's going to put a lot of pressure on not just the critical resource nurse, but all of the nurses, all of the staff. That one doctor in the hospital can't possibly be at everything. That one critical resource nurse can't possibly be at everything. Getting transportation to and from the hospitals in time, it puts patients' lives in jeopardy.
The next question that we have for the panel this evening is, how will these closures affect other hospitals within the region?
I'll do it.
One of the things that currently happen right now is as our services in the OR are diminishing, we're not having as many patients come from our department up to the floors. So then when Mercy is getting overloaded with patients because they've been having really big surgery schedules with a lot of admits, they're taking their patients and transporting them over to Unity Hospital because they don't have beds at Mercy. And, so it's overloading the Mercy Hospital, it's overloading North Memorial, and, we did a fair caseload at Unity for many, many years.
So one of the things I wanted to mention was that I've been told, I'm just a doctor, I've been told that the state monitors the number of intensive care unit beds they have. I can assure you, most of the time, all our beds are occupied. And there are times, in fact, once every couple of days when Unity receives a patient from another hospital because there is no intensive care unit bed in the state. So Allina did not increase the number of intensive care unit beds in Mercy. So I'm not sure what the plan is for these patients who are going to need ICU. Step down unit that they are planning, I don't know if it meets the technical criteria for intensive care. Therefore, these other hospitals who've had to transfer patients to Unity because they didn't have an ICU bed, I don't know what the plan for those patients is. Are we going to, I know during COVID, we actually had to transfer patients to Wisconsin. So are we going to be sending patients to Wisconsin because we're out of ICU beds? I don't know.
I mentioned this earlier, but with the closure of pediatrics at Mercy, the children will have to go to children's hospitals in Minneapolis and St. Paul or Masonic in Minneapolis, and they are often full at capacity even now, and so that's just going to further overwhelm the system. There's going to be longer wait times. There's going to be probably more kids boarding in the ER, and it's even days in an emergency department. They don't receive ideal or even standard of care. It's just not set up to do that. And so it's certainly going to overwhelm an already overwhelmed health system in the pediatric world.
As an outsider looking in, as somebody that uses these facilities, that have to use these facilities, Allina has already closed Cambridge Pediatrics, I don't know how many years ago, where they shut that down for kids inpatients. So kids in the North Metro, if you're north of Coon Rapids anywhere, and you rely on Cambridge as a doctor for your kid, you can't go to Cambridge to have them stay there. So your next option is Mercy. So with closing Mercy, you're sending everyone north of Coon Rapids, Anoka, to Children's, like they've said, where you hear of horror stories of kids are in their bed in the hallway. It's like a movie almost, where the hospital is so overloaded that these kids are going to be laying in the bed in a hallway. With closing Mercy, they've already done it to the North Metro, farther north, closing Cambridge, and now we're going to do it to Mercy, which is just anyone north. I don't think that people north of the Coon Rapids and Anoka realize how big this closure of Mercy is going to be to these kids that are going to have to drive an hour without rush hour. And we all know that the Twin City rush hour is constant, especially with road construction.
The next question we have, in light of what Zach just talked about, is, how are these closures at Unity and Mercy going to further impact our exurb and rural hospitals? And I might reference a lifeline here in the audience. Dr. Schweiger, do you want to come up?
Hello, my name is Dr. Lisa Schweiger. I'm a pediatrician at Cambridge Medical Center. What Zach was referencing is he lives in Isani. He had a young child who had a very severe respiratory situation, came to our ER. Our hospital stopped having the ability to admit children. Well, I was there for about 20 years. I think this happened maybe 4 years ago. And so they could not send him home from the ER because he was too ill. Then had to emergently transfer him to Mercy. And once he got to Mercy, he nearly died, but they saved his son, right? And I've heard many stories like that. I'm devastated that I can't, even though my life is a lot simpler not being on call anymore, I'm devastated not to be able to care for my patients in this way. Allina also closed our labor and delivery and newborn nursery almost 2 years ago, which every day is just weighs on my heart and as well as my colleagues, both the nurses and doctors. It was so against what all of us felt was right, and we were not listened to. Allina felt it was simply as easy as saying all of your maternity patients need to just drive down to Mercy, which is a minimum of 45 minutes away, and even more for my patients that live north of Cambridge, and that's just not safe. I asked for there to be safety and quality studies done when this decision was made and afterwards, and was ignored. I honestly don't know what kind of bad outcomes some of these patients have had, but I'm certain there have been bad outcomes just because of the number of patients that literally we saved their lives and had to do so within 10 minutes, not 45 minutes of getting to Mercy. So yes, it very much affects my practice and my patients in Cambridge, but also all the other communities up in that area because there's nowhere else to go. I mean, the next stop is going all the way to Children's or U of M or going up to Duluth or going to St. Cloud. And for most patients, that's not just it's just not an option. Maple Grove Hospital stopped pediatric patients not too long ago. Yeah, there's just no other option, and it's horrible. We live in a state that's prided itself on excellent and progressive medical care, and we are just going backwards. And somebody's got to stop it. They don't listen to us anymore. Doctors used to be the primary decision makers within hospitals and medical systems. Even if the administration was above us, they actually used to listen to us and do things that made sense. Then maybe in the last 10 years, it started being where they would decide to make decisions and then would say they were listening to us, let us vent, but still it didn't change anything. Now they won't even meet with us. They just make the decisions. And it's got to stop. We have to pull together between doctors, nurses, community members, legislators, etc. If we all pull together, we can change things.
Wonderfully said, Dr. Schweiger. And then next question here is, so these layoffs these closures have impacts on patient care. But they also have impacts on workers, and several workers have been laid off in light of these recent closures. And so the next question is, in light of rampant burnout in the medical field, Allina has chosen to lay off doctors, nurses, and other healthcare professionals who are in high demand all over the United States. From your point of views as workers and also community members, why do you think Allina is choosing to make these changes in facilities now?
It's money.
You want it.
I think the obvious answer is money. I think Allina is trying to consolidate services so that they believe that they can save money.
One of the processes that we do now, we have a business manager that runs our department right now. And for a case to be put on at Unity Hospital, it has to go through him. He's a wonderful man, but it has to go through a business manager to see if we can do a surgical case at Unity Hospital. It is money. It always has been money. So that's it.
So at this point, it's pretty clear Allina is acting out of the idea of driving down their bottom line rather than focusing on patient care. And so with that being said, that's also why we're so thankful that you're here this evening, is to make sure that we're partnering together to be able to fight back against that and really putting patients first. And we've got a couple of asks this evening that are at your table, but before we get into those, we wanted to open it up for you all in the audience, as community members, as workers. Do you have any questions for myself or the panel at all? And we can try to answer to the best of our ability. If you've got a question, my mic doesn't reach, so if you want to come on up. We get a little courageous in this town hall.
So I'm just curious on the mental health units, both at Unity and Mercy, and what are going to be the status of those and what will be affected with those. I know we're a little off topic from the primary care or the ICU or whatever, but I was just curious about that.
I don't know what the plans are regarding those, but I can comment on one thing that I've heard from my fellow psychiatrists who take care of mental health patients. Because Allina is closing down the OR, we are not going to have the ability to sedate and anesthetize our patients for procedures which are needed sometimes. Well, the main procedure that's needed is something called ECT that is done frequently on inpatients in the psychiatric unit. And with this closure of the OR, we're not going to have anesthesia there. And
they'll have some.
They're going to.
Yeah.
They are going to do?
Yeah.
Okay.
They did come.
So that's a change, because initially there wasn't going to be anybody, and now they're telling me that there is going to be staff available to do that. Okay.
When mental health came to Unity Hospital, a lot of my coworkers said I should go up there, but it all started on 1 West or 4 West, and then it moved over to 4 East. Now they're moving patients down to 3. I believe that eventually Unity will become solely a mental health facility, because eventually patients that need simple procedures or for broken arms and stuff, they're going to stop going to Unity because they're going to be tired of being transported to Mercy and to North and Maple Grove. So then it'll just make it easier for that facility to not provide any of the basic medical care that the community needs.
And I would say too, like in our experience as these closures have happened, they're frequently not completely thought through. Not all of the details are there. They're coming with these sort of half-baked plans and sort of like carrying things out as it goes. So, we'll do our best to answer these questions, but oftentimes we're not always getting all of the details on the front end. It's very clear that Allina has a long-term vision for their patient care, and they're not always telling us what that is. They're pretty cunning, and there's that. I have another question in the audience.
Could you speak to what percentage of the hospital population the inpatient pediatric service takes? What percentage of beds? 2%, 3%, 4%, 20% of the inpatient beds?
I'm not sure on the exact number. What they are claiming they're closing is 2 2 pediatric beds. What we have now is 2 dedicated pediatric beds, but we can take more pediatric patients than that, up to 29, I suppose. The floor that we put all the kids on in the family care unit can take up to 29 patients. We've never had 29 patients, but so I'm not sure. Compared to the whole hospital, I'm not sure. But pediatrics, compared to all the adults, is pretty small, but it does still serve a need in the community. Yeah.
And then in terms of the ICU services, what Allina has told us is that they are changing the definition, and so they should be getting only, they should be able to take 86% or 80-some% of the original patients. But that's still, you're talking 15-20% of patients they can no longer take. And the OR services, to Dr. Sharif's point, is just completely disappearing and moving elsewhere out of Unity. Any questions?
When Allina bought Unity for $1, did they have any obligation in return to the community?
I don't have that history. I do know that in I believe it was around 2015, 2016 when that occurred, it was a part of a larger deal. But I don't have the exact answer to that. I will say in Minnesota, not-for-profit hospitals are in Minnesota do have a responsibility through community benefit spending and charity care to give back to the community. In terms, there's a group called the Loan Institute, and basically Allina and other large healthcare corporations within the state of Minnesota get very low grades in terms of how much they're actually giving back to the community. And so we know that essentially for being taxed, basically forgoing being taxed, these large corporations are not giving back the way they should in terms of paying back the community. So we do know that for a fact, and the Loan Institute is highly reputable and well respected in the healthcare community.
Was the Minnesota Department of Health invited to this meeting, and if so, did they decline as well? Or is there somebody who's going to be invited?
The Minnesota Department of Health was invited to this meeting this evening, as were Allina corporate executives. And so, this is like an undercover boss sort of scenario that maybe bosses or MDH are hiding, like in the audience. We did invite them because this community meeting tonight is about what a community meeting, what MDH should be doing. Right now, there's no law on the books. We're actually trying to get a law passed that would make it a requirement that these closures would require an in-person community town hall such as this, so there's a space for people in their community to be able to provide feedback. Another thing too, in terms of the MDH hearing process, is that we experienced this within the last couple of weeks, is essentially they cozy up with the hospitals. It was very clear before our MDH hearing that they had pre-planned how they were going to tackle the hearing. And in that hearing, they refused to answer some of our most basic questions about how it's going to impact care. And so the MDH process needs to be improved. It needs to look like this, and our government officials need to be able to make sure that they're holding hospitals accountable, just like all of us have to also be accountable to the law.
A comment and a statement. I'm Chris Angelak, I'm a local family physician.
Wait, I can't hear you.
I'm Chris Angelak, I'm a local family physician. There are medical studies that have been done that show how close you live to a hospital will impact your survival in an emergency. So, we have a wealth of experience with doctors and nurses. I'd like a show of hands from everybody. Who thinks these changes are going to result in more people dying unnecessarily? Okay? That's what we need to bring forth. That's what we need to band together for, to support ourselves.
That was incredibly powerful. Thank you. Question?
I'm Dr. David Weiniger, and I put in 37 years at Mercy Pediatrics, and retired 3 years ago, but came out to the meeting at Mercy and to this one because I just love the doctors that I've worked with over the years. I love the nurses, and I can't tell you how hard they work at just giving great care. Now, a little bit about myself and how this, and I'll get to a question for the hospitalist here in a second. I'm an Indiana boy, and I went to college and med school in Indiana, and I decided to do something different and come up to Minnesota for my last 3 years of training, but I had a job I was going back to in South Bend. But in the middle of the night, part of the residency, I was able to moonlight, and we went around the middle of the night, ambulance, air travel, and that. I came up to Mercy and picked up 3 kids in the middle of the night, all from Dr. Jeff Lebo, and many of you will remember him. And he said, "Why are you going to go back to Indiana? This is a great place." And so I had lunch with him, and he showed me around Mercy and met some of the nurses, and told my wife, "We're staying here." And I've been an inpatient at Mercy one time for 31 days. I've had 4 surgeries there. I've had 4 grandkids born there. I'm really proud of what Mercy has been, not only in pediatrics, but in adult medicine. So later on in my practice years, I was involved, I was the head recruiter for the clinic I was with. I hired, well, I didn't hire him, I probably can take credit for it, but there are many factors, but I took him through Mercy, and it was a major factor, 4 out-of-state pediatricians moving here. And I don't think the 5 of us would be here without a pediatric unit. Why go through a pediatric training and take a practice where you can't use any of it? Just clinic medicine. And for simple kids, well, simple, but a mild asthma, a gastro with mild dehydration, a kid with jaundice who couldn't be treated at home, now they're going to have to go to children's, and that's just not right. So I started at Mercy in 1983, and with the doctors and the nurses, the families up there, up here, they got good care. And I was really proud of that. When we were told the hospitals were coming, I was one of the 3 pediatricians arrogantly said, "What do we need them for?" And I'll tell you this, without any question, care got better when they showed up. We couldn't go to the ER and evaluate kids like they could. We could come in the middle of the night and see them. We had to work the next day as well. They could go because that was part of their job. If we admitted a kid, if they were unstable at all, or parents had questions, because there's more than just the medical care. We don't take care of the kid, we take care of the family. And they could go and they could take care of the family and the kid whenever it was needed, 24 hours a day. So without a question, care is better with the hospitalist. And now I'll get to my question. Families are still going to bring their kids to Mercy in the middle of the night. I talked to a friend today and said, he works in Anoka, he's got a business there. And I said, "Did you realize," that was today, "did you realize that Mercy is closing pediatrics there? He's got 2 kids." He goes, "What in the world are they doing that for?" He didn't know a thing about it. And neither will scared parents with a sick kid in the middle of the night. We're doing all of this, and it's great that everybody has taken time out to do it, but in the middle of the night, most families are going to take their kid to Mercy. There's not going to be a peds unit, there's not going to be hospitalists, but there's still a sick kid in the ER. And I just wonder if you can kind of paint the picture of what that's going to be like, as far as getting them the care they need. Because when I was in the office and needed to admit a kid, I could call the hospitalist and I could say, I got this kid with such and such, they need to be admitted. Do you agree? Yes. We have a bed for them. Have them wait in the clinic for half an hour, and then send them to the hospital. They don't have to go through the ER. They come straight upstairs. Children's doesn't do that. They give great care there, but everybody is admitted through the ER, and that's where the families will wait after they've waited to be seen in the ER at Mercy as well. So I kind of rambled, but I'm kind of passionate about this because it's going to affect the families in a great way when the kids are vulnerable. It's going to cost them in transportation time, work, finances, and the care overall that they get. And it's just not right.
I think Zach is going to speak to this.
Yeah, so pretty much, I don't have an answer to your question, but I do have pretty much exactly what you just said happened to me. It was October 11th. My son is 5.5 months old at the time. He's teething. He starts to get a runny nose. October 11th was a Wednesday. We said it was runny nose, so we let it be. Friday came around. He was starting to get like a little cough with it, so we let it be, teething. It's normal. Saturday came around. We had breakfast. We had lunch. 3 o'clock hit. My son does not cuddle. Will not cuddle. He started to cuddle, and I told my wife, I said, we need to watch him. You could kind of see the color leaving his face. And by supper time, I couldn't even pick his head up off my chest. And I said, we need to go, and we need to go down. And Cambridge was where we went. It was 8 o'clock at night when we went into the ER. When we arrived at the ER, his oxygen would not go above 90 on 6 liters of adult oxygen, is what we were told. It still did not go to 90. At about 10 o'clock, the ER doctor came in and said, you have 2 options. You either drive him to Mercy, or you drive him to Children's, or you take an ambulance to either or. We were given that option at 10 o'clock. By midnight, the doctor didn't give us the option anymore, and it was by ambulance to one of those 2. He said we either go to Mercy, which they had a bed available for my son, or we go to Children's, which, like you said, we would have to go back through the ER, which we didn't go to Children's in the first place because of the wait that would already been there. We chose the bed. We got transported by ambulance. Well, actually, it was midnight. The ER doctor came in and said, you're going to get transported. The ambulance is going to be here in an hour. By 12:15, the ER doctor came back in and said, you're getting transferred right now. The ambulance is outside. We get outside, and the ambulance is a North Region ambulance. It's not even an Allina ambulance. So, going back to the transport, we're having to use an outside, not even an Allina ambulance, to bring my son to Mercy. We get to Mercy, we get up to the room, Dr. Bender and her staff are there, and they start changing him from the ER or the ambulance bed oxygen over to the room oxygen. They put him on that room oxygen, and his oxygen plummeted to 70 as soon as they took the mask off. They put the 6 liters back on of adult oxygen and another mask, so they had more oxygen than he could handle, and it still didn't work. They had to bring him a high flow machine in to force oxygen into his lungs, which then finally got it above 80. If we would have chosen Children's, we celebrated my son's first birthday 2 weeks ago. I would have celebrated it at a cemetery 2 weeks ago because Dr. Bender, as soon as we got to Mercy, my son went limp and white. And Dr. Bender was rubbing his chest and saying, you got to stay awake, you got to stay awake. And her and her staff were there to help us through it all. They were not freaked out. They were calm. They kept us calm. It took 3 days for my son's oxygen to get above 85 on a high flow, 10 liters, 50% oxygen. There's no way that my son would have made it another 35 minutes to Mercy, or to Children's, back through ER. Those families up north do not realize what is happening.
I don't really have much more to add. I think that speaks for itself.
Question up here.
I don't have a question, just a quick statement. My name is Taylor Delsing. I'm also one of the PEDS hospitalists. I would just like everyone in the room to know that currently Allina's plan, as they're stating it to us at least, is that they're still going to have pediatricians at the hospital. And so they are really leaning into that when we raise concerns like that, when in reality, they're going to have a pediatrician during the day to see nursery babies. And so kids don't wait to get sick like that until daytime hours, right? Most of the time that's happening overnight. And so while our ER physicians are amazing, they don't have the specialized training to help a small child when they're in respiratory distress and declining rapidly. So I think it's just really important to know that even though Allina continues to, say they'll have PEDS coverage, it will be entirely different than what it is now.
Question in the back. Thanks for making the journey up here.
I will keep this as short as possible. My name is Jen. I worked as a medical secretary at Unity for almost 20 years. I was sad to hear what was happening with them closing down OR and all the other departments. And it was disheartening for me until it hit me personally. Last week on Tuesday, my 15-year-old son developed 103 temp. We live out in the Buffalo area. He's always been healthy. Took him to Buffalo. Got him into ER at 12:30 in the afternoon. With the resources that we no longer have, it was an 18-hour journey to get him admitted to Children's. There were no ambulances that would come out to pick him up. By the time they had him off from the IV, off from the antibiotics, everything that he needed, we had to transport him ourselves at 2 o'clock in the morning to get to Children's Hospital at 3 o'clock in the morning to sit in their ER for over an hour with 104 temp. No pain meds, no antibiotics, and no answers. So I just want to make that clear. If this is the future of how the children in the metro area are going to be taken care of, we had a great outcome after everything that we went through, but I don't want to see any more children or any more families go through this. We need to keep these resources open.
I've got 2 questions over here, way in the back, and then our doctor here next. I feel like I just want to be able to run towards people with this mic, but I can't.
All right, I want to talk without crying. I've been at Unity for 45 years as a nurse, for the last 30 years as a critical resource nurse. Listening to these stories and hearing about these kids and knowing that we're having patients in front of us, that we're waiting for an ambulance, that we're waiting for the help, that we're waiting for somebody to get us into a situation where we can save lives. We came into nursing and into our doctors came into our medical fields in order to help people. We are not pieces of puzzles that you're putting together, that you're going to a store and picking out a new puzzle. We are people. This is a community. When Allina was bought out, Unity, I stood before that, and they promised us that our community would continue having its resources. That was the promise we were all given. That promise, I can tell you right now, is not there. There is not enough people in this room because people are not aware. We need to somehow get our community aware. We're trying to get the word out. anything anybody can do to get this word out, we need it to happen, and we need it to happen now, because it's too late. I've already had to rebid for my job after 45 years. This is insanity. This is criminal. We are people, these are patients. I do not want a patient dying in front of me because I do not have the resources at my hands. We need each other to get together on this. And I'm sorry for everybody that's gone through something where they didn't have the resources they needed, that the nurses couldn't get to your bedside when they needed, because that is not how we want to practice nursing. That is not how doctors want to practice their field. I know that. We have a passion for what we do, and we're here for you. Please help us.
Hello, everyone. My name is Dr. Carol Larson, and I'm a pediatrician working at the Coon Rapids Clinic down the road. And I've been in practice for 24 years, so I've seen a lot. I have practiced when Unity still had an inpatient labor and delivery unit and an inpatient pediatrics unit. I've been here before we had a pediatric hospitalist group. So I've been the doctor in the middle of the night that's gotten a phone call, Dr. Larson, we are admitting someone, we need you here now. We are coming to you as community members because we need your help. We are here fighting for you. And when we have an organization that the chief operational operator, the chief medical operator, they're not here. And we are here for you. I have had the experience of having my own children being admitted both at Mercy Hospital as well as down at Minneapolis Children's. And knowing how difficult that was for me, someone who's married, has a full-time job, has access to transportation, has resources, has community and family support. When I think about my poor patients, my single moms, unemployed, have to rely on public transportation, that have to, if their child needs to be admitted, that they have to go down to Children's Hospital. I mean, it's just, I think it's a travesty. And, you know, we are here, this is our community, we want to take care of our community members, and that includes our inpatient psychiatric patients, that includes surgeries, that includes adults that need to be admitted, that need ICU care. We need your help saying back to Allina, this is not about the bottom line. This is not about dollars and cents. This is about our patients and our communities, and you need to step up to the plate and take care of our communities as a community organization. So we need your help. We need your voices. Let Allina know how much you think this is wrong.
That's a lovely segue. So I just want to, we'll take one more question, and then I'm going to move on to how today we can all do something to try to make change together.
This is not so much a question, but more of a, maybe an approach to take for getting the word out. I know for Conservation Minnesota, they send out postcards saying if you support this or that for water quality, etc. And you just mail right into your legislator, the address is on there. I wonder if you guys could do something like that.
I'm so glad that you said that, because it's at your table. So at everyone's table, there is tell Allina executives community care, not corporate cuts. And so this is an opportunity because, like has been said tonight, like healthcare workers are here to advocate for you, but this is a fight that everyone has to do together. Like, these corporate hospitals make nearly $1 billion a year, and they are literally taking advantage and balancing their budgets like on your patient care. And so now's a really good opportunity. Please write. We're going to mail these to the corporate executives of Allina and other decision makers. Please take the time to write your thoughts and what Allina needs to know in terms of the closures. And then when you're done on your way out, there's a basket by the sign-in. If you didn't sign in, make sure you do that so we can get your contact information, because today is just the start. Like, this has to be a community effort, because we can't beat this and we can't beat Allina without each other. And so with that being said, we've got postcards, and then we also have another table activity that we would really appreciate all of you doing as well. And essentially that table activity is like writing down what you think your perfect hospital looks like. You know, what does it look like for you as a patient? What does it look like for workers? What does it look like for the community? Because we want to know what your vision is so we can build it together. And we can continue to meet and move forward in building community hospitals and healthcare that works for everybody.